Hey guys, I'm Mateo. I'm a physical therapist with over 2 decades of experience in rehab and recovery. Today, we're delving into the crucial aspect of post-surgery rehab, recovering from an ACL surgery. This video is part of a broader series from my book, The Holistic Health Roadmap, Clinical Guide to Weight Management for Surgery, Recovery, and Chronic Illness. You've just undergone ACL surgery, a procedure that mends one of the most crucial ligaments in your knee. The journey ahead might seem daunting, but with dedication and the right guidance, a proactive approach, you can rebuild strength, regain mobility, and return to your daily activities with confidence. As you embark on this rehab journey, keep in mind that every individual's body and recovery rate is unique. Our goal is to provide you with the evidence-based advice and exercises to support and enhance your healing while helping you maintain a healthy weight. A study published in the American Journal of Sports Medicine emphasizes the importance of structured rehabilitation in achieving optimal recovery outcomes. In this session, we're going to guide you step by step through the early, middle, and late stages of rehab following an ACL surgery. It's crucial to perform each exercise within a pain-free range of motion. Begin with one set of 10 repetitions and gradually work your way up to 4 sets of 10 repetitions. Ensure you execute every exercise slowly, focusing intently on maintaining proper form. Remember, exercises after an ACL surgery require activating and deactivating certain muscle groups. However, this procedure is nuanced. Make sure you perform each exercise with proper form and take your time. Disclaimer: before starting any exercise regimen, especially post-surgery, always consult with your healthcare professional. This series is intended to be a supplementary and should not replace professional medical advice. Ready? Let's get started on this journey towards rebuilding your strength and mobility after an ACL surgery.
Anterior cruciate ligament reconstruction often involves a patellar tendon graft, creating stability within the knee. This surgical procedure replaces the torn ACL with a tendon graft, allowing the knee to regain its function. Post-surgery rehab, as outlined in the Holistic Health Roadmap, aids weight management and recovery, ensuring a holistic approach to regaining knee function. During the initial 2 weeks, the goal is to reduce swelling, improve circulation, and gently restore knee motion, setting the foundation for later stages of recovery. Each exercise should be pain-free. Firstly, step to gait pattern with a walker or crutches promotes stability by ensuring weight is evenly distributed. This method minimizes strain on the healing knee by engaging core and leg muscles, aiding in safe and gradual mobility restoration during early recovery. Begin by advancing the walker first, then stepping forward with the operated leg, then bringing the non-operated leg to meet it, using the walker or crutches for support. Next, short arc quad exercises activate the quadriceps without excessive knee movement. This controlled activation helps maintain muscle strength, which supports the patella and overall knee stability, crucial for early recovery and prevention of muscle atrophy. Lie on your back with a rolled towel under the operated knee, then straighten the leg by lifting the foot while keeping the knee on the towel. Additionally, supine ankle pump improves circulation by facilitating blood flow back to the heart. This exercise helps reduce the risk of blood clots and decreases swelling, promoting a healthy recovery environment by activating the calf muscles and enhancing venous return. While lying on your back, pump your ankles up and down by flexing and extending the feet. Moreover, heel slides restore motion by gently bending and straightening the knee. This exercise enhances joint flexibility and reduces stiffness by mobilizing the knee joint and surrounding tissues, crucial for preventing adhesions. Slide the heel towards your buttocks, then straighten the leg, keeping the movement smooth and controlled. A plastic bag or smooth surface can be used to reduce friction. Furthermore, seated knee extension with well leg assist provides controlled movement, gradually increasing knee extension range. This method ensures safe progression by using the non-operated leg for support, preventing overloading the healing tissue and aiding in neuromuscular re-education. Start with your feet down, then use the non-operated leg to help lift the operated leg, straightening the knee. During weeks 3 to 5, the focus shifts to enhancing strength and flexibility while maintaining joint stability. The following exercises promote these goals, crucial for progressing towards full recovery. Firstly, step through gait pattern with cane enhances balance and coordination. This technique supports weight transfer and stabilizes the knee during ambulation, engaging the core and lower body muscles, essential for advanced recovery stages and improving functional mobility. Step forward with the operated leg and cane simultaneously followed by a step through of the non-operated leg in a fluid motion, using the cane for support. Next, standing heel raises strengthen the ankles and improve balance. By engaging the calf muscles, this exercise provides essential support to the knee joint by enhancing lower limb stability, crucial for overall proprioception and gait efficiency. Stand holding onto a support, rise up onto your toes, then slowly lower your heels back to the ground. Additionally, standing knee flexion exercises increase knee flexibility and range of motion. This movement targets the hamstrings, promoting balanced muscle strength around the knee, essential for joint stability and reducing the risk of strain or injury. Stand holding onto a support, bend the operated knee, bringing the heel towards the buttocks, then lower it back down. Moreover, seated knee extension boosts knee strength by isolating the quadriceps. This controlled exercise enhances muscle support around the knee, improving patellar tracking and knee function, vital for progressing to more challenging activities. Sit with legs bent at a 90-degree angle, then straighten the operated leg, holding briefly before lowering it. Furthermore, the seated hamstring stretch pose stretches the hamstrings, enhancing flexibility. Improved hamstring length reduces strain on the knee joint, supporting balanced muscle function and joint health, crucial for overall lower limb mobility. Sit with one leg extended, reach forward towards the toes, holding the stretch gently without causing pain. Additionally, the seated knee to chest pose enhances flexibility in the hip and knee. This stretch aids in restoring full range of motion by elongating the muscles and connective tissues, critical for overall lower limb function and reducing stiffness. Sit and draw the operated knee towards the chest, using your hands to hold it in place. Hold for 5 to 10 seconds. Finally, supine straight leg raise exercises strengthen the leg muscles without bending the knee. This exercise targets the quadriceps and hip flexors, promoting muscle strength and joint stability, essential for maintaining muscle mass and preparing for weight-bearing activities. Lie on your back with one leg bent. Lift the straightened operated leg to the level of the bent knee, then lower it slowly. From weeks 6 to 8, the focus is on advanced strength, balance, and mobility. The following exercises are designed to challenge the knee and prepare it for a return to daily activities. Firstly, standing supported lunge boosts stability by engaging the quadriceps, hamstrings, and glutes. This exercise enhances knee strength and balance. essential for dynamic movements by promoting functional strength and joint alignment. Stand with one foot forward and one back. Lower the back knee towards the floor, then return to the starting position. Hold on to a stable surface for stability. Next, alternating step-ups reinforce lower limb strength and coordination. This functional exercise mimics daily activities, promoting practical recovery by engaging multiple muscle groups, enhancing cardiovascular fitness, and improving muscle endurance. Step up onto a raised platform with the operated leg, then step down and repeat with the other leg. Repeat as tolerated. Keep track of time or the number of steps. Additionally, single leg standing enhances balance and proprioception. This exercise challenges the knee's stability by activating stabilizing muscles around the knee and ankle, crucial for safe and confident movement in varied environments. Stand on the operated leg while maintaining balance, using support if necessary. Hold up to 20 seconds as tolerated. Moreover, mini squats foster knee mobility and strength. By engaging multiple muscle groups, this exercise supports joint stability and prepares the knee for more demanding activities by enhancing quadriceps and gluteal strength. Perform a shallow squat by bending the knees and hips slightly, then return to standing. Furthermore, seated leg press with Thera-Band engages muscles without overloading the knee. This controlled resistance exercise builds strength in the quadriceps and glutes, aiding overall knee support by promoting muscle hypertrophy and endurance. Sit with legs extended, press against a Thera-Band looped around the foot of the operated leg, straightening the legs. Hold for 3 to 5 seconds. Additionally, aquatic jogging protects joints while providing cardiovascular and muscular benefits. The water's buoyancy reduces impact, allowing for safe and effective knee rehabilitation by providing resistance and support, crucial for improving muscle strength and joint function. Jog in waist-deep water, maintaining an upright posture. Your goal should be 3 to 5 minutes. Finally, aquatic single leg. Hopping challenges stability and coordination. The water's resistance provides a safe environment to enhance knee strength and proprioception, critical for dynamic movements by promoting balance and muscle coordination. Hop on the operated leg in waist-deep water, using the buoyancy to reduce stress on the knee. The buoyancy of the water makes this exercise safe. Progress to land as tolerated. Adhering to these exercise parameters ensures a structured, safe recovery, promoting optimal knee function. Remember, strength does not come from what you can do. It comes from overcoming the things you once thought you couldn't.
As we conclude this segment of the Recovery Roadmap to Enhance Healing, focusing on ACL surgery, we hope you found the insights and exercises beneficial. Remember, the journey to recovery is a marathon, not a sprint. Your dedication and perseverance are fundamental in regaining strength and mobility. Staying consistent with the exercises and following professional advice will lead to the best outcomes. While we've equipped you with the tools and knowledge, always prioritize your body's signals and consult with a healthcare professional regarding any concerns. The exercises and advice presented in this series are designed to support your post-surgery journey. Individual experiences and results may vary. Always maintain safety and consult with your healthcare professional. Thank you for trusting us with your recovery. Stay motivated, embrace each milestone, and remember, healing right and staying light is a process. We're here for you every step of the way. For a non-clinical virtual consultation, you can always book an appointment at www.chatwithapt.com. Thank you guys so much.